So for self-care, if you think about it, massage therapy is we're working in this position, shoulders internally rotated, and the arms are going into, we have flexion and horizontal adduction of the shoulders. So we're in this position, we need to open up. And if I can use this CLX band, some of my favorite exercises. Let's tighten her up here. We need to squeeze those scapulae together and extend the wrist. Very, very important for massage therapists. I'm strengthening the rhomboids and the middle and lower trapezius and my wrist extensors to go completely opposite of what massage therapists are subjecting themselves to all day long. Another one I like is to work the serratus anterior muscle, and so it's a push-up with a plus because we massage therapists use the serratus anterior muscle all day long. It's the muscle used for a punching motion or a fencing motion, and so this is a great activity for toning up and strengthening that serratus anterior. I already showed you the pec minor work where I can put this CLX under my foot and I can strip down as I reach back like I'm catching a fly ball. So there's the pec minor work, self-care, because a lot of massage therapists have really, really tight pec minors. Start at that coracoid process and strip down the ribs 3 to 5, and we can work that pec minor muscle. And another good one would be with a regular band. I could use the CLX. I'll just use the CLX. That's what Phil wants. So another really good one, chin down, head back, and then pull forward. And this will help get rid of that forward head posture. Chin down, head back, eyes level, and pull forward. And that way we can try to combat forward head posture. Very, very important that we work it. So the hand exercises are great. You can use them, put them in the freezer, or you can put them in the microwave for thermal therapy. You can do hand exercises with them, squeeze them, but I use them as a shock absorber. My students love these. And what we do is when we're doing a deep stripping stroke, I try to keep the wrist straight. We put the hand exercise ball in there, and a lot of times I will reinforce my wrist and do a deep stripping stroke, say to the hamstring. I had about a 7 out of 10 on the pressure scale. And what we do is it acts as a shock absorber for the knuckles. It takes the pressure off your knuckles and it makes your hand harder, so you have to work less. You can get a deep stroke without hurting your hands and your knuckles. You're protecting yourself by using this hand exerciser. And as I say, we've been using them for years. When you do use these, you have to wash them after you work with a client. So wash them with whatever disinfectant you use, and then rinse them off well, and then you put a little powder on them because they're going to get tacky after you wash them. That's an important part of using these. But I always have 2 of these. It depends on the size of your hand. You can use the big one if you have a bigger hand, or this round one if your hand's a bit smaller. And they come in different densities, starting with yellow, red, green, blue, and black. Now the black one I keep it in my freezer, and if my wrist is hurting me or my epicondyles are hurting me, then I will do the common flexor tendon. I'll just massage myself on the black ball after I take it out of the freezer. That's another use I really have. The black one is a really, really firm one. And the other hand exerciser The hand X trainer, it's for working the hands in the opposite direction. Instead of the compression we have, it works the opposing muscles, and it replaces the putty. And we can do opposition, abduction, adduction, and I also use it to stretch out. Now the black one is best for this. You don't want to rip it apart. You know, use your common sense and don't rip all the holes up.